on production of alcoholic beverages in sachets and PET bottles that are less than 200 mils. The National Agency for Food and Drug Administration and Control stopped the registration of alcoholic beverages in sachet and small volume PET and glass bottles that are below 200 mils, based on the recommendation of a high-powered committee of the Federal Ministry of Health and NAFDAC on one hand, the Federal Competition and Consumer Protection Commission on the other hand, and the industry also represented by the Association of Food, Beverages and Tobacco Employers, AFBTE, the Distillers and Blenders Association of Nigeria, DBAN, in December 2018. So it is about 5 years ago when we had this high-powered meeting. As commitment to the decision reached, as commitment to this decision that was reached at the end of this high-powered meeting, producers of alcoholic beverages in sachet and small volume PET bottles less than 200 mils agreed to reduce the production by 50% with effect from 31st January 2020, while ensuring the product will be completely phased out in the country by 31st January 2024. On the part of the agency, NAFDAC committed to ensure that the validity of renewal licenses of already registered alcoholic beverages in the affected category do not exceed 31st January 2024. We did not give any permit that exceeds that date. The people who are mostly at risk are the negative effects of consumption of the banned pack sizes of alcoholic beverages are the children, primary school age children, secondary school age children, and commercial drivers and riders. The World Health Organization has established that children who drink alcohol are more likely to use drugs, get bad grades, suffer injury or death, engage in risky sexual activities, make bad decisions, and have health problems. WHO also stated that harmful consumption of alcohol is linked to more than 200 health conditions, including infectious diseases, tuberculosis and HIV/AIDS as an example, and non-communicable conditions like liver cirrhosis and different types of cancer. It is also associated with social problems such as alcohol addiction and gender-based violence. So the take-home from this meeting is all about protecting children, underage youth, from getting liver cirrhosis that could lead to cancer, that could lead to death. To curb the menace of alcohol abuse, World Health Organization recommended some actions and strategies to policymakers that have been shown to be effective and, of course, cost-effective. And these include regulating the marketing of alcoholic beverages to younger people and regulating the availability of alcohol to younger people. NAFDAC was established by Cap N1 laws of the Federation in 2004 to regulate and control the manufacture, importation, exportation, advertisements, distribution, sale, and use of food, drugs, alcohol inclusive, cosmetics, medical devices, bottled water, detergents, chemicals. All these are known as regulated products. Alcoholic drinks in sachet or PET bottles or glass bottles below 200 ml are pocket friendly. These are pocket friendly. One can be easily pocketed by primary school children, and they do that. Not all of them, few do that. They are pocket friendly and can easily be carried around by children without being noticed. It is easily affordable and comes handy for commercial bus drivers, keke riders, okada riders, who, after consuming them, constitute a menace to the society. The negative impact of harmful consumption of alcohol by this age group, which is occasioned by its being very economical, easily accessible, and miniature in nature, prompted NAFDAC to take the bold step of banning it in order to save our children from harm and to protect the health of the larger society. Therefore, the main reason for calling this press conference is to intimate you to the government policy of banning the importation, manufacture, distribution, sale, and use of alcoholic beverages in sachet, PET, and glass bottles below 200 ml. As at the 31st of January 2024, there should not be alcoholic beverages in these categories that is registered by NAFDAC. We have stopped the registration. I also want to inform you that the agency started enforcement actions of this policy on February 1, 2024. And this enforcement was done simultaneously at the same time in various cities across the country. Meanwhile, many products at the manufacturing facilities in various cities such as Jos, Enugu, Ibadan, Lagos, and Ota were evacuated, and others put on hold due to sheer volume and size that we could not evacuate, but all are waiting destruction. And the enforcement continues. We started February 1, which was last week, 2024, and it will continue until we make sure there are no sachet alcohol in circulation and in PET bottles or glass bottles less than 200 ml. The 5-year window given to manufacturers by NAFDAC to phase out all alcoholic drinks in this category elapsed on the 31st of January 2024. So there was a 5-year phase-out period because we considered that manufacturers would have invested in machinery, in staff that were dedicated for those lines. Therefore, a 5-year phase-out period was given. To this end, on the first day after this phase-out period, the agency commenced nationwide enforcement actions on the 1st of February 2024. The manufacturers and printers of labels and packaging materials were the initial targets. It will surprise you to know that during the enforcement actions last week, it was discovered that some manufacturers of these banned products were still in production of the products and still had stacks of both finished products and packaging materials in their possession. This situation is of course not acceptable, and the agency views this as flagrant disregard of regulatory measures put in place to safeguard public health, especially children. NAFDAC views this matter seriously, and we engage all statutory means, which may include prosecution, to deal with the issue. I want to use this medium to ask all holders of alcohol in sachet, PET, and glass bottles less than 200 ml, empty sachets, empty PET bottles, empty glass bottles, labels, and other packaging materials of these banned products to immediately report to the Investigation and Enforcement Directorate of NAFDAC for handover of sale for destruction, in order to prevent sterner measures that can include prosecution. NAFDAC is resolutely committed to the strict implementation of regulatory measures towards safeguarding the health of Nigerians, particularly the vulnerable youth, against the dangers of reckless consumption of alcohol with the attendant negative health consequences and social vices. Other foods or even medicine, sometimes they fake, sometimes they fake our numbers, sorry about that. And that is why we have a post-marketing surveillance directorate that from time to time do surveillance. Sometimes they do mystery shopping to see those that don't even have our numbers, or those that we know, we suspect either through intelligence that the products have been faked, or the numbers. So we do through surveillance, and the community also has to help. If it is too good to be true, please take it that very likely it is not true. The average consumer on the street may not know which one is regulated, which one is NAFDAC number that is genuine or not genuine. But there are always some factor that may bring such out. The price may be too cheap compared to what you bought like last week or previously. Where you are buying it is another problem. The appearance of it based on history, packaging. If there is a suspicion, please let us know. A lot of our successes have been based on intelligence. People telling us, we think this one may be wrong, this one may be right, or whatever, and we go after them. So we have post-marketing surveillance and enforcement that are responsible for monitoring or following up and sanctioning, as the case may be, for people that fake our numbers. There are exceptions though, but they fake our numbers, because I don't want anybody to walk out and say all NAFDAC numbers are fake. No, there are exceptions. Nonetheless, we need support and collaboration. Channels, my colleague from Channels said that why this 5-year window? It was a difficult thing for us in NAFDAC. But the manufacturers actually went to the ministry when we said we're going to ban 5 years ago. So all of us came together in the ministry, and they said that, well, they've invested so much and they need time to phase out. That many people will be unemployed, and how do we, it's a difficult decision. That was why the then Minister of Health said that, okay, we will have a phase-out period so that there will not be any excuse. And that is why we are very, very focused on the enforcement. But from your perspective, it is rational. From my perspective, it's rational. But when you look at this holistically, there are machines that have been built for this. There are people that are there running the lines. We said, okay, let's phase it out. And bear in mind, January 2020, there was a decision in which we didn't register the volume. They reduced the volume, they agreed with us. So it was kind of step-by-step means of making sure that at the end of the period, there will not be any excuse. Thank you. And then, which manufacturers? We have many manufacturers that make sachet alcohol and, also in PET bottles, less than 200 mils. These are just examples of what our investigation and enforcement, this is the director of investigation and enforcement. These are just examples of some of the companies that they went to and seized their products. These are examples of those products. But there are many, so it's not like we can list them. And we are still doing enforcement. We are business friendly. So it's not like we are putting anybody out of business. Many of these companies make products greater than 200 mils. And we cannot legislate, we cannot ban alcohol in general. It is responsible drinking of alcohol that manufacturers expect, or that we also expect to happen. But when it comes to children, you cannot put burden of responsibility on a child, especially when you have very fancy packaging material or volume. I've heard that some children think it will make them to be smart in school. It will make them to be smart, but slowly their liver will become compromised. By the age 20-something, they may have liver cirrhosis, liver damage that can lead to cancer or death. That is why it is all about underage children. Thank you.
Thank you, ma'am.
Any